Bata-bata, paano ka ginawa? Ako si Angel Rivero at kasama ko po ngayon si Doktora Ana Belen Alensuela. Hi, Doc!
Hi, Angel!
Kayo po ay isang reproductive health and infertility doctor.
Yes.
Yan. Hindi po ba siya parang kapag OB-GYN kayo ay nagiging infertility doctor na rin kayo?
Okay. As far as a doctor is concerned,
Yes po.
dalawang klase yun. We have obstetrics and we have gynecology.
Okay.
When we talk about obstetrics, we're talking about a woman who's pregnant already. So we take care of her. We also practice gynecology here. Yun yung lahat ng mga disorders ng babae bago pa siya na hindi siya buntis. Pero dito kasi sa Philippines, what happens is pare-pareho na kami. Ang obstetrician, siya rin ang gynecologist.
Akala ko nga po isa lang yun eh.
In other countries, magkaiba siya. Iba yung obstetrician, iba yung gynecologist.
I see.
So, ang tanong mo, kami bang mga gynecologist ay reproductive infertility specialist?
Yes.
Right? Lahat ng gynecologist dapat marunong gumamot ng infertility.
I see.
In other words, parang pansit. Lahat dapat ng may bahay marunong magluto ng pansit.
Na-pressure ako.
Na-pressure ka doon. Kaya lang, kanya-kanyang specialty. Merong luglog, merong kanton, may bihon.
Yes.
Yon. So, pagka medyo deeper problem na at mas mahirap ng gamutin, kunyari, kailan ka pupunta sa infertility specialist?
Yes.
Number one, when you are 35 years old and above, dapat infertility specialist na yung pupuntahan mo because you are running out of time. Yes. Okay. Why? Kasi in our lifetime, we will only ovulate 400 eggs. Yung 100 nung teens, nung second 100 nung 20s, third 100 nung 40s, 30s, tapos yung last 100 40s. So talagang paubos na, kaya ang 35 and above dapat sa specialist na pumupunta.
Bakit po 400 lang samantalang pag napapanganak tayo parang thousands naman yung mga eggs na nasa loob?
Yun ang natural history ng egg cells. Ang natural history, actually we are born with 2 million oocytes.
Oh my God!
At birth. Tapos pag nag-enter ka ng puberty, 400,000 na lang. Yun ang natural design, di ba?
So, nawawala na lang po sila?
Namamatay sila. Yes.
Okay.
Many are called, but only a few are chosen.
Oh,
di ba? Kaya 400 lang i-ovulate mo. So when you are 35 years old and above,
konti na lang talaga siya.
so kailangan nagmamadali na tayo, di ba?
No.
Unless hindi ka nagmamadali. I know marriage is something wonderful. It's supposed to be a union of two people who wants to be together for the rest of their lives. But being a parent is the most wonderful feeling that I have ever had.
Really?
And I would like to share that with all of my patients who would like to have one, di ba? Second, sabi natin, years, saka yung age niya. And second, ang kailangan din yung the duration of infertility.
Okay.
Usually, if you have been trying to conceive for 3 years or more, tapos hindi pa natatapos, hindi pa nangyayari, then you have to go to an infertility specialist.
Kahit na ano pong edad?
Well, lalo na kung 35 years old
Ay,
ka
nako,
na.
double trouble yun.
35 years old, 3 years na kayo nagtatry, nakakatakot yon, di ba? Dapat sa specialista.
Yes.
Okay, let me clarify that. Kasi, okay, when are you going to consult a gynecologist for your infertility? If the couple has been trying to conceive for 1 year, unprotected, regular sex activity. Ang ibig kong sabihin ng regular is at least 2 to 3 times a week.
Okay.
Hindi naman yung once a month. Regular nga
Hindi
yun,
na
pero
regular yun.
Diba? Imposible na makabuntis.
Chamba na lang
right.
yun.
So, if you are 35 years old and above, hindi ko dapat maghintay ng 1 year. 6 months ka lang na nagtatry kayong mag-conceive, then you have to go to a gynecologist already.
Okay.
Now, which gynecologist would you go to? Would you go to the specialist or the general gynecologist? Again, to go to the infertility specialist when you are 35 years old and above, or you've been infertile or trying to conceive for 3 years or more, o kaya dati kang merong surgery. Let's say for example, dalaga ka, nagkaroon ka ng endometriosis, alam mo may problema ka, go to the specialist already. You don't even have to wait for 6 months.
Diretso na?
Yes.
Okay.
Kunyari, kakasal ka pa lang. O, pupunta ka na sa doktor, di ba, sa gynecologist, Doc, I'm gonna get pregnant, I'm getting married, and I would like to prepare for a pregnancy. What are the things that I should do?
Okay.
In fact, if you have endometriosis, hindi ka dapat mawawala sa gynecologist mo. you should be taken care of forever.
I see.
Kasi this is one of the many causes of infertility. Pero mamaya natin siguro pag-uusapan yun. So going back, kailangan mong pumunta sa infertility specialist pag 35 and above. Kapag matagal na yung infertility, o kaya dati kang nagkaroon ng surgery, right? Or kaya yung lalaki. And we have this misconception that pregnancy is only the job of the woman. Duh, right. I mean, if my patient comes to me, I require that the husband should be with him.
Dapat lang, Doc.
I can't make her pregnant. Ako lang, wala naman ako si Milya, di ba? Para naman pwede i-reseta si Milya.
Tama.
Diba? So, I emphasize that kailangan kasama yung husband. And if the husband also is smoking, o kaya the husband has had mumps when he is a teenager or adult na.
Mumps?
Yes.
Okay.
Yes. As a child, the mumps is okay. Pero sometimes kasi pagka-adult na nagka-mumps, bukod sa namamaga dito, namamaga din yung testes.
Hindi ko alam yun.
Oh, yes. And that can cause infertility.
Kahit na matagal na yung mumps nila?
Yes, it can. Okay, tandaan mo, Angel, hindi lahat ng nilalabasan mayroong bala.
Pero I find that so bizarre, na parang nilalabas pero walang bala.
Oh, because iba yung pinanggagalingan ng semen, iba yung pinanggagalingan ng seminal fluid.
Right.
So, it goes out of the same duct, but it comes from different canisters. Therefore, the canister for the sperm might be blocked. O kaya walang laman yung canister, pero yung para sa fluid, merong laman.
Ang galing. So, mag-shoot siya, pero maaring walang nakasakay doon.
Yes.
Aba, tandaan nyo yan. Hindi
Shooting
ko alam
blanks.
yun.
Oh, diba?
Shooting blanks.
Shooting blanks.
Ang ganda.
And that's in our, because of our culture. Sa atin kasi babae, submissive, siyang tagadala. Hindi yung lalaki. Most of the, well, not all. Before, kasi in my earlier practices of infertility, men don't come with the women. But right now, women are more empowered, men are more educated, they come. They come to the clinic. Because I refuse to treat just a woman. Hindi ka, walang mangyayari sa amin, di ba?
Yeah, tsaka parang double standard naman yun. Kaya maganda at nagbabago na.
Yes, nagbabago na.
Attitude.
Because we are educating our people, our women, the couples. Kaya nga maganda yung mga talks like this.
Yeah.
Because we can reach out to the people. Nahihiya kasi silang tumawag.
Yun nga eh.
Kasi there's a stigma eh.
That's right.
Natatakot sila, in the Philippines, kailangan pagka kinasal ka, susunod ng anak na.
Pag kukulitin ka.
Diba, super ang pressure, diba? So, pagka may gathering, unang-una, pag dalaga ka, at mga 25, 27, ano ba? Kailan ka mag-aasawa, diba?
Yun
ang first
Yun
pressure, diba? Ang mga titos and titas of Manila, diba? Ang ano naman nila, they just care. But they don't realize na masakit, diba? And alam mo kasi ngayon sa atin, I find our younger generation very achieving.
Yeah.
Yes, they have relationships with the opposite sex, but it doesn't mean papakasal na sila.
Yeah, iba yon.
Hold lang, mother, di ba? Ang mga mudra, putak ng putak, di ba? Di ba? Hold lang. I just want to be with somebody, but it doesn't mean I'm gonna get married now or I'm gonna start a family. Most of our working young population would rather explore first.
Yes.
Tapos tsaka sila mag-aasawa.
Yes, and to meet the right one and make your career flourish,
I know.
earn more money, save up, di ba?
Which brings us to the second problem. Yes, because you work hard and you're concentrated on career and exploring the world. When it's time for you to relax and have your own kids, medyo may age na. Kaya tayo nahihirapan.
Right. Pero I think the good news, Doc, is that hindi naman doon nagtatapos, di ba? Parang may pag-asa naman.
Yes.
And that's why doctors like you are here.
Yes. Kasi gaya nga sa WHO, tinanggal na niyo yung infertility. Actually, it's called sub-fertility.
Sub-fertility. Yan ang
na lang.
Politically correct na pala.
Yes, sub-fertility because there is, with advances in medicine, wala nang imposible.
Ang galing.
Diba? With advances in medicine, wala nang imposible.
I like that. Yeah. In your experience, Doc, as a doctor in this field, what were among the most impressive cases or kumbaga mga akala nyo malabo na to pero wow, nagkaanak?
We have older women I had a 42-year-old patient. She really wants to have a pregnancy. She got just like typical. She has focused on her career, wanted to have a pregnancy, and then found the right man. They have been trying to conceive for the past 2 years. It's a good thing that she is educated and she came earlier on. We tried probably IVF several times. On the 3rd cycle, she became pregnant.
Wow.
Yes.
So si IVF po ay hindi laging gumagana agad.
Yes, hindi siya yung first line. Actually, we don't do in vitro fertilization or test tube baby for our audience, baka hindi alam, ng routine, okay?
Okay.
Hindi lahat ng pasyente for IVF.
Okay.
Meron kaming mga requirements, characteristics na hinahanap before we give. Kasi of course, you try first the other ones, mag-ovulation in that. You try to find out first what's the cause.
Yes.
Before you do IVF. Hindi yung basta-basta IVF lang.
Of course, that sounds about right. Ngayon, Doc, mula sa Facebook page natin, ay meron tayong tanong.
Okay.
From one of our readers. And the question is, saan po nakukuha ang endometriotic cyst at may gamot po ba para dito?
Okay, saan nakukuha ang endometriotic cyst? Ang endometriotic cyst ay cyst siya ng ovary.
Okay.
Cyst siya ng ovary. So, saan po nanggaling yung cyst na yon?
Yeah.
Okay, galing siya sa sakit na endometriosis. Ano po yung sakit na endometriosis, doktora? Then we go to the uterus, yung bahay bata. So, kunyari, may bahay bata, tapos nandito yung dalawang ovaries, di ba? Yung bahay bata kasi natin, may 3 layers yan. Yung outer, yung muscle, tapos yung endometrium sa loob.
Okay.
Yung endometrium ang kumakapal every month in preparation for a pregnancy.
I see. So, yun din po yung natatanggal.
Yes, if the woman does not become pregnant, that becomes menstruation.
Okay.
Alright. Ano ang endometriosis? Meron kang endometrium sa labas ng uterus.
Bakit po nangyayari yun? Parang ang weird.
Well, there are several theories but we really don't know why. Okay? Kaya, dahil hindi namin alam kung saan siya nanggagaling, hindi din namin siya magagamot. This endometriosis is a disease for life. Habang buhay, meron ka niyan. So, kung meron kang endometrium sa uterus, may endometrium sa ovary. Pag kumapal yung sa uterus, kakapal din yung sa ovary. Pag dinugo yung sa uterus, lalabas siya sa menstruation, pero yung sa ovary, naiipon lang sa loob.
Oh no, nakatrap po kasi siya.
Yes, that's why these women will present with pain, dysmenorrhea, during menses. So, naiipon ng naiipon. So, ang endometriotic cyst ay old blood na endometrium sa loob ng ovary.
Oh.
Yes, so that's endometriosis. So, ano po ba yun, doktora? Masama po ba siya? Cancerous po ba siya? Endometriosis is a benign disease.
Okay.
Kaya lang, hindi siya cancer, okay? Kaya lang, it behaves like cancer. It eats everything in its path.
Oh, that's scary.
Yeah, it will eat the ovary, it will eat the fallopian tube, it will even eat the bladder, it will eat the colon.
bladder?
Yes, everything down there. Yes, that's why you have to stop it from growing.
So,
I said we cannot treat, but we can stop it from growing.
okay.
But because it's a lifetime disease, you take the medicine forever.
Oh.
As long as you're, no naman, hanggang sa mag-menopause ka na.
Okay.
Because this endometriosis grows because of your estrogen and your progesterone. And we have that hormones. So we have to lower down the hormones so that we can stop the growth. Madali naman siya, kaya naman siya.
Pero wala pong surgery involved dito para alisin yung mga part na tumubo.
Surgery can be necessary.
Okay.
Okay, hindi lahat ng may endometriosis inooperahan.
Okay.
Alright? So, inooperahan lang yung mga endometriosis na number 1, malaking-malaki na nagkakos ng symptom, na nagkakos ng obstruction, kasi dahil nga nagre-respond siya sa gamot Depende kung ano yung ang complaint ng pasyente. 3 ang complaints ng pasyente with endometriosis. Number 1, pain. Number 2, infertility or sub-fertility. Number 3 would be just the bukol.
Ay!
Yes.
As in may bukol talaga.
Oh, yeah. Oh,
Okay.
yeah. Okay. Yes. So, number 1, kung pain lang, hindi opera ang sagot.
Okay.
Kasi hindi 100% mawawala ang pain sa opera. So, second, meron naman tayong effective na gamot to take care of the pain.
Okay.
Alright? So, we can give that. So for our women out there na nagdi-dysmenorrhea tas binigyan ng pain reliever ng doktor, uminom po kayo, hindi po nakaka-addict ang pain reliever, di ba? Kasi ganun yung misconceptions ng mga patient. Doktora, ayoko niya nakaka-addict. Hindi kita pwedeng bigyan ng addicting na gamot, di ba? Okay. So number 1, for pain, first line is medicine. Number 2, infertility. Okay, or sub-fertility, you're trying to conceive. Actually, the first line is not also surgery. We try to do something. We try to make her ovulate. Hindi lahat talaga opera. Because sa amin ang dictum, the first surgery should be the last surgery for endometriosis. Kasi nga, paulit-ulit siya. So hanggat maaari, hindi ka mag-oopera hanggat hindi kailangan.
I see. Nakakainis pala na condition yan, no?
So yung third indication is may bukol. Pag malaking-malaki na yung bukol, then that's the time that we have to remove it. Gaano kalaki yung malaking bukol, doktora? Depende. Yes, that's why you have to go to your gynecologist because only your gynecologist will be able to assess whether you need the surgery or not.
Paano po siya nakikita? Like via ultrasound?
Right. Papa-ultrasound natin because we want to make sure that it's endometriosis.
Yes.
It's not something else.
Yes.
Okay, kasi tatandaan, ang ultrasound, huwag sisisihin kasi hindi siya perfect. Hindi siya 100% sure kung ano yung bukol na yon.
Oh.
Yeah, to be sure 100% kung ano yung bukol na yon, i-biopsy natin. Eh di nag-opera na tayo, di ba? So we're trying to find out what's the cause of the bukol in a non-invasive way.
I see. And very well explained, Doc.
Thank you.
Ngayon yung relevance po ng pagtatanong ng ating viewer is that because 8 years na daw silang kasal ng asawa niya, 8 years, ang tagal na po. At hindi pa rin sila nagkaka-baby nang dahil siguro dito sa endometriotic cyst. So, that's kind of a problem they're in, aren't they?
It is. Number 1, she has endometriosis. Endometriosis, as one of the causes of infertility, is the most difficult to treat.
Oh, I see.
Second, the duration of her trying to conceive. They've been married for 8 years.
8 years.
8 years. So I think she should see a reproductive endocrinology specialist. Now na. Why? Because you have an endometriotic cyst. Baka kinain niya na yung mga remaining follicles mo. Paano na tayo? Diba? Although I said surgery is not the first line, if it is necessary, we will do it.
Yes.
I mean, no doctor would like to do surgery left and right. There's always a danger. Diba? There's always a danger. Hindi mo alam kung anong pwede mangyari. So we always weigh what is going to be beneficial for our patient. Then that's what we do.
I see. So yung endometriosis po is one of the many conditions that a woman may have. Pero in your practice po, have you noticed any commonalities kung ano pa yung mas madalas na reasons for sub-fertility?
Okay. So, let's say we have 100% na couple. Let's say we have 100 couple who comes to you who wants to become pregnant. 35 of the 100 is because of the female.
Okay.
35 of the 100 is because of the male.
So fair.
Fair na yan, okay? Tapos merong 20 of the 100, that's a combination of both.
Oh, okay.
Yeah, both male and female have a problem.
Oh.
And then there is a remaining 10 of the 100 who are both normal but can't conceive.
Parang unexplained.
Unexplained sub-fertility. Okay. So, tinanong mo sa akin kung ano yung mahirap. Mahirap yung male.
Talaga?
Mahirap ang male sub-fertility.
Akala ko gamot-gamot lang yun.
Depende.
Okay.
We must find out kung bakit walang bala.
Oo.
Diba? Number 1, is there a problem na wala talagang laman, yung testis? Or may bara sa testis? Or may problem sa factory? In other words, kasi kailangan ng hormones in the making of the sperm cell.
Yes.
Baka walang hormones na enough. Now, kung ang problema ay hormones, yun may gamot.
Okay.
Paano kung wala ng sperm?
Oo.
Wala na tayong magagawa.
Ay!
Pag wala ng sperm, what's going to happen is we're going to get a biopsy of the testis to check kung meron pang sa loob.
Masasalvage.
Yeah, I know. Pero kung wala na, then where will I get the sperm?
Yes.
In our country, sperm donation is considered unethical.
Yeah.
Hindi siya bawal, but it is unethical. Right. Diba?
Right, I see.
So, that's the male. Ano pa bang problema? Yun ang major problem kadalasan kaya nagpa-vasectomy na. Diba?
Ay, pag ganun, Doc, wala na, di ba?
Pag nagpa-vasectomy, we try to reverse the vasectomy, but it depends on how long the vasectomy has been done, at saka yung size ng testis that's remaining. Kasi kunyari 15 years or more na, mahirap na siyang i-reverse.
I didn't even know na reversible pa siya.
Yes, it can be reversed. I do have a partner urologist in my practice. Pagdating dun sa male factor, binibigay ko na sa kanya.
Wow, that's really interesting.
Other than that, IVF lang.
Now, moving on, let's talk about, Doc, some of the more high-tech and interesting things about sub-fertility or fertility in general. Yung pag-freeze po ng eggs.
Oh!
Yeah, tapos pwede rin pala po mag-freeze ng embryo. I did not know that because akala ko po kapag buhay na, tuloy-tuloy nang lalaki yon. Pero apparently, pwede palang i-freeze.
Oh, yeah.
So, would you recommend freezing your eggs?
Yes, I would.
Why?
Why? Okay. Number one, if you are gonna go for chemotherapy.
Ay, oo.
Kunyari, iki-chemotherapy ka. Okay. About freezing, what do we freeze? We freeze the sperm, we freeze the egg, we freeze the embryo, right?
Yes.
Okay. If you have a husband, I'd rather freeze the embryo than your egg or the sperm. Because the survival is better.
Kapag embryo na.
Pag embryo na. Okay? So, kailan ako nagpapa-freeze ng sperm? Let's say, for example, OCW yung husband. Diba? So, pwede natin i-inseminate yung wife. Even if the husband is not here.
Ang galing,
Kaya lang, kailangan yung trust nandun. Ay, kasi diba, baka pag-usapan pa ng mga kapitbahayan.
Ba't
nabuntis? Wala ang asawa. O tapos may BFF na kahit ding pinagkamalan pa. Diba?
Oo nga naman.
Yeah.
Oo
So,
nga.
yun yung medyo last ko yun. Okay? Tapos, then we freeze the egg.
Okay.
Dati kasi, how do we freeze the egg? It's either we get the tissue and then we freeze it, or we harvest also the egg. We make it grow, and then we get it from the woman's ovary. Then we vitrify. That is now the term that we use, vitrification.
That's when you freeze it.
Yes, that's when you freeze it so fast. Okay, there is a process. So, if you have a husband, don't freeze the egg, freeze the embryo. If you don't have a husband, you're young and you're for chemotherapy, go. Freeze it. Okay?
When you hit a certain age po ba, is it parang cut off na for freezing eggs? Kunyari, 40 ka na, pwede ka pa ba mag-freeze ng eggs?
Okay. I tell my patient the truth.
Yes.
Before she comes to me for freezing, then there are laboratory tests that we do, and we're going to tell her, look, the AMH is low. This laboratory is low. The chance of us getting a lot of eggs is low. Are you going to take it? That's informed consent.
Right. Tas nasa sa kanya na.
Yes. May liberty siya eh. Doktora, ngayon lang ako nagkapera. Di ba, ngayon lang ako natakot. I have patients like that na has been working hard and then suddenly, boom, ay, 40 na pala ako.
Oo.
Wala pa akong boyfriend.
Ay!
Para hindi ma-pressure ng mga titos and titas of Manila.
Yes.
Di ba? I-freeze niya yung egg niya.
Ayun.
So that when the time comes, when the right man comes, may egg siya.
Tama.
O, di ba?
Pero may maintenance cost din po yan.
Oh, yes. Pero maliit lang.
Okay.
Depends on the laboratory that you would go to. And right now, we have one in Cebu, one in Davao, 3 in Manila who does that.
Wala po bang expiration date yun? Yung mismong frozen embryo or egg?
Most of the studies have shown na viable siya up to merong 5, merong 10 years.
Okay.
Okay, so as long as depende sa laboratory yun. Yeah, so that's why it's a little bit expensive because it's an egg that we're trying to freeze and we're trying to maintain for a while. So kailan ka pa magpapa-freeze? So magpapa-chemotherapy, tapos kaya I have a patient. Natanggal ko na yung left ovary kasi nagka-ovarian cyst. Tapos yung right ovary nagka-cyst din. So konti-konti na lang yung ovary na natitira. So sabi ko, okay, let's just recover for a while. After this, we have to freeze your egg. And she's only 28 years old.
Oh, no. Oh,
di
yeah.
ba?
Pero at least para may reserba na.
Kasi mauubos na yun eh.
Oo.
Remember, whatever is there, let's say for example, she has 200,000 remaining. Hindi naman lahat yun mag-grow.
Right.
So that's why, kung merong mga potential, parang ano yan eh, may mga potential na mga mag-aartista. Right? Okay. Oy, magaganda. So lahat ng magaganda sasama natin, pero pipiliin natin. At least we have a lot to choose from.
Yeah, I see. And when it comes to freezing the embryo naman, Doc, you freeze the embryo dahil habang bata pa yung couple, parang bata pa na fresh sperm, bata pang egg, and then magiging embryo na po sila, and then you freeze it.
Oh, we freeze most of the time, how do you say that? Dito sa practice sa Philippines, people would come to me for IVF because they want to have a pregnancy now.
Okay.
Okay, so most of the, iba-iba kasi yung stimulation protocols. There are times when we will be able to harvest 2, 3, or even 9 eggs. So kung 9 eggs ang na-respond ng ovary mo ngayon, anong gagawin kung doon sa iba? Usually, 2 lang naman yung bibigay natin, di ba? So, i-fertilize lahat ng 9. So, kung sino man yung mag-grow sa 9, 1 or 2 lang ang i-transfer mo eh. So, what do I do with the 7 remaining?
Tago ko
We
na
freeze
lang.
it.
Ah.
Okay. So, kasi, pagka transfer ko yung embryo ngayon, hindi naman 100% ang IVF.
Oo nga.
On the average, IVF will give you 30 to 40% pregnancy rate only.
Ay, okay.
30 to 40% pregnancy rate. So, if now the cycle hindi nag-take yung embryos, next cycle, we can transfer the frozen embryos. So, cost-wise, hindi na kita i-stimulate ng gamot.
Oo.
Di ba?
Tama.
Tapos, hospital-wise, hindi na masyadong mahal kasi ita-transfer na lang yung embryo eh. And you're just maintaining that embryo. Plus, complication-wise, konting-konti lang. So,
And in the future din, Doc, kunyari, gusto mag-anak ulit.
Pwede pa rin.
Okay, okay. So sa palagay niyo po ba ay dapat may parang ina-allocate din na budget talaga?
Oh, yes.
Okay.
Oh, yes. Alam mo, Angel, kasi chemotherapy. Mahal ang chemotherapy.
Ay, super, oo.
Okay, so what does chemotherapy does?
It treats cancer.
And it prolongs life.
Yes.
What do we want? Make life.
Yes.
You think it's going to be more expensive? Of course. But that's life. Diba? It depends on how you value life. How important is a child for you?
Right.
Kasi there are couples who are happy just together. They're enjoying each other. No judgment. If you're happy with each other, good. Because we get married because we want to spend the rest of our life with the one that we love. Children are blessings from God. Pero paalaga lang sila. Eventually, iiwan tayo ng children eh. You will leave your mom and dad and spend the rest of your life with husband, right? Ganun yun, di ba? So at the end of the day, you start just the two of you, you end with just the two of you. Right? So, children are options, are blessings. Pero kung importante sa'yo, or if you have a little chance, di ba? Kaya ka nga nagtratrabaho.
Oo nga eh.
Actually, mura na ang IVF ngayon. Hindi na siya kasing mahal noon.
Talaga
Yeah,
po.
oo. There are cheaper, reasonable medicines now kasi law and supply and demand. Ang dami na nating IVF centers ngayon. Dati kasi isa lang. Ang dami na ding mga gamot na nadadala dito.
So, economy of scale.
Yes, exactly. So, hindi naman siya ganun kamahal. Pero kasi kung nagtatrabaho ka naman at nakakapag-abroad ka, pumupunta ka ng Japan taon-taon, di ba? Konting dagdag na lang, pwede na yun.
Oo nga naman, Doc, no?
Di ba?
Tama kayo doon. Guys, that's life.